Hello, my name is Dr. Roopa Mehta. I'm an endocrinologist from Mexico City. So, does the published data in my region reflect what I see in clinical practice? Now, that's a very interesting question. There's very little published data in Mexico on the whole. We do have data from the HAT study, which gives an impression that hypoglycemic events are common. At least almost 90% in type 1 diabetes, and also very prevalent in type 2. However, in clinical practice itself, I treat mainly type 2 diabetic patients, so I think hypoglycemia is underreported. The patients themselves maybe aren't aware that the symptoms that they're suffering from are because of hypoglycemia. So unless I specifically ask the patient, have you had sweating, palpitations, and do you feel that your blood sugars go down, very often they will not report this to me. So I think there is a lack of awareness in patients, but also in physicians. We find that possibly many physicians don't think about specifically asking for hypoglycemia, and so obviously it's underreported. In my own clinical practice, as I've mentioned, I treat mainly type 2 diabetic patients, and I do find that unless they're on a sulfonylurea or on insulin, I'll probably not find a huge number of cases. I do have some data from a recent study that was carried out in Monterrey, which is in the north of Mexico. And this was carried out in a tertiary care hospital. And what they found, they looked at the determinants of hypoglycemia and the rates of hospitalization for hypoglycemia. And what they found that the main determinant, at least in type 2 diabetes, was if the patient was taking a sulfonylurea. Almost 85% of the patients with type 2 who had these episodes were on these medications, and at least 30% were on insulin. The eGFR was another determinant of the risk for hypoglycemia. Obviously, patients with lower renal function tended to have more episodes. This study also calculated costs, and they basically said that if patients who came in under the internal medicine department, they tended to stay longer number of days. So they ended up between about 5 to 6 days duration in hospital. And of course, that's a huge cost burden for patients in this region. When we think about what are the factors that are particularly relevant regarding hypoglycemia in patients in Mexico, so when we consider the challenges of hypoglycemia in Mexico, one of the huge problems is cost. Many patients are on sulfonylureas because they can't afford any of the newer drugs that obviously have a lower risk of hypoglycemia. So, many type 2 patients are managed on sulfonylureas. They're not educated about the risks of hypoglycemia, and this probably leads to these hospitalizations, which are totally avoidable. So cost, the socioeconomic situation of the population, has a lot to do with the rate of hypoglycemia. In addition, many patients are not accustomed to measuring their blood glucose levels. Even though glucometers are not that expensive, the test strips themselves are. So many patients tell me, for me to be measuring my blood glucose on a regular basis will be difficult, in particular type 1 patients who don't have the resources to buy these test strips. So that also makes the detection of hypoglycemia quite difficult. I also believe that hypoglycemia affects adherence, particularly to insulin. We did a recent study regarding omission of insulin doses in type 1 diabetic patients, and one of the principal factors was cost, but also the fear of hypoglycemia. So if a patient is afraid of having a hypoglycemic episode, they will omit insulin, and of course that results in high A1Cs and a greater risk of complications. Patients themselves may be unaware of hypoglycemia, but there is still this overwhelming belief that type 2 diabetic patients have a low risk of hypoglycemia. So I think there is a lack of awareness in physicians, maybe at the primary care level, this is more rife. And as a result, if the physicians aren't aware, they're not going to be asking their patients, they're not going to choose the most advantageous regimens for them, because for them, hypoglycemia is not an issue in type 2. Obviously, cost is influencing the prescription of sulfonylureas, but it may also be influenced by this belief that type 2 patients have a low risk, so yes, let's use sulfonylureas. It doesn't make any difference. So I think that has to change as well. And I think generally in Mexico, it's underreported. There's a huge unawareness, and there are also these socioeconomic factors that mean that patients are generally on older insulins or on sulfonylureas to control their diabetes. So in Mexico, we do need policies to allow access to the newer insulins, the newer hypoglycemic agents, which have a lower risk of hypoglycemia. This was very difficult to achieve. The health service in Mexico is very fragmented, and getting one of these newer agents into the government services so it's freely available for all patients is going to be very difficult if we don't have cost effectiveness data to kind of say, if we put patients on these agents, we reduce the risk of hypo, and in the long term, this is cost benefit to the whole healthcare system. Because we don't have data on that, that's going to be very hard to achieve.